Hey everybody, it's Eric with Motion Guidance. Thanks for joining me today. We are going to be diving into the topic of how to utilize motion guidance for your post-op knee surgical patients. So ACL reconstructions, total knee arthroplasty, anything along that line. So I'm excited to bring this content to you because this is a big topic across the whole world. With the aging population that we're seeing here in the United States, especially seeing a lot of joint replacement. With the athletic population, we're seeing a lot of knee injury that can require surgery. And so most of the focus on those types of surgeries comes into four main categories that we're going to discuss today. So we're going to be discussing how to get terminal knee extension, which is huge for all functional activities, as well as a mainstay of the protocol for the early rehabilitative process for this population. How to improve quad function, more specifically with the motion guidance device, how to improve the feedback for quad function and how they can understand how they're getting terminal extension, if they have a quad lag while they're performing quad setting or straight leg raising or short arc quad. We're also going to be looking at how to use motion guidance to improve visual feedback during gait, to help normalize gait. We have some research that's been published in the ACL population, how gait deviation can extend for months and months, all the way up through 9 months post-operatively, and then how to progress through closed kinetic chain exercise, the early phase activities, so sit to stand, that type of stuff. We might even have a little bit of time to touch on dynamic movement later on in the rehabilitative process, but we'll see how time looks and how we want to move with the chat as we go on, okay? So let's get started. I'm going to share my screen, and we'll start looking at some videos first designed toward the quad. So we'll look at setup and the application and what that means. All right. So let me share my screen here. Great. All right, so let me get out of this screen. We'll minimize this. All right, so let's take a look at this first video. So this is our typical setup for a patient that might come in post-operatively. So we're going to look at a quad set and a leg raise. So there's a few things that are going to happen here, and I'm just going to toggle through this video so you can see. And we don't have to keep repeating this. So we're going to take that medium-sized strap out of the clinician kit. For the people that have our newest version of this kit, we have four straps. We have one that goes along the wrist. The next one up from that is the one that I typically use for the knee. Then we have one that's going to be more around the head neck area. Then the next size up is usually for a trunk or as an extender for those patients that are definitely larger. So I tried to standardize the application here. So I'm going to put this on the thigh, but a set distance from the kneecap. So oftentimes I just use my distal phalanx of my thumb, and I measure up 3 joints lengths from that, and that's where I apply the motion guidance strap. Then I'm going to use the flat mount, and then the laser put on top of that. So if you have the clinician kit, you'll have a green rechargeable laser, or you chose the 2 options for battery-powered lasers. Once we turn that on, I want to project the laser onto the wall, as you can see in this video, or out in front of the patient. They don't even have to be close to a wall. You just want it over the top of the toe. And what you're going to see as they start to quad set is that laser should actually come down onto the foot. Okay, so if we stop it here, if they pull their toes back into dorsiflexion, that might contact the laser, but then we want the laser to move down the foot, okay, just like that. If the laser's moving down the foot, that's going to represent extension of the knee, or at least the lower shank is going to moving up, which is relatively the same thing. This is going to be critical for a few reasons. A common issue with the patients in this population is that they are tightening their quad, but they might get a co-contraction of the hamstrings. They might get a co-contraction of the calf, which is actually going to help flex the lower extremity. So I'm going to encourage dorsiflexion to try to get the calf to stretch a little bit on that gastrocnemius in the back, and then have them tighten their quad and push down toward the table. If they get a co-contraction, that laser will not move further down the foot. they're going to, especially if they get flexion, then it's going to move up back onto the wall in this case. If they can get a good quad set, the patella is going to move superiorly, that knee is going to move down, and they're going to see the laser move down their shoe or their foot closer toward the laces. One really good input that you can give as a clinician, if they can get this movement, is then trying to encourage them to move that laser further down. And you can make a mark on their shoe. You can encourage them to go to their laces, anything like that, and have them hold that. And then they can just perform repetitions of their terminal knee extension there, or their quad set, to get that. Now, if they can't get that move, you can always put a towel roll underneath their heel, and then have them push down toward the table with their knee while leaving their heel up, and that laser will start to move down their foot that way. Okay, so if I just keep backing this up and looping it, if she's not flexed, you can see right here, she's flexed in the quad, she's not tightening it up, or excuse me, flexed at the knee. That laser goes up the wall as she does that. As she starts to tighten and pull that toe back, and she tightens that quad, the laser moves down the foot right there. Okay. Then she can be ready, if that's crisp and very achievable, then she can move on to a leg raise. So if she goes on to a straight leg raise, she wants to try to keep the laser on the foot the whole time during that straight leg raise. All right. If she can't, and this will go through the video here, two things happen. Either you're going to notice a quadricep lag, where when she starts to lift, the laser is going to move right off her foot. Okay, so it's going to start there with a quad set, and then the laser is going to move up the wall, which means she has lost extension. And that's going to be very easy for the patient to see. And this is a huge value for the motion guidance feedback early on, is that the patient understands that they're losing quad efficiency. If you're going to lose quadriceps efficiency, then they're going to go home and they're going to do repetitions of this particular exercise with that inefficiency, which means they're going to lock in the deficit that they would have maybe achieved in your clinic, or that they have before they come back in. And then they would have done tens or maybe hundreds or possibly even thousands of repetitions of a quad set or a leg raise, where they between visits, and they're not maximizing that terminal knee extension. And as we hopefully all understand, that terminal knee extension is going to not only help the quad efficiency, it's going to mobilize Hoffa's pad, so that anterior interval right behind the patellar tendon, and that's going to reduce pain if that's mobilized for most patients. And that's going to make their terminal knee extension remain if they have that. So that early quad set is effective for mobilizing Hoffa's pad, and we're going to see that with the laser as the patients are going through that. Now, the second thing that can happen is when they go through their leg raise, as they come back down, that's going to be a tough challenge for them to maintain it on their foot, and they'll start to see the laser move off. All of these examples are going to be highly motivating for the patient. So if a patient can understand where the deficiencies are, then they can maximize their effort to correct these, and then maximize their efforts and efficiency for each session that they're going to be performing this exercise. All right, so that's quad setting and combined leg raising for your post-operative patient. And of course, you could use this for just anterior knee pain as well. If I get rid of this and we go on to terminal knee extension, okay, then we can show this happening here. And what you'll see in the video is the laser is placed at the same aspect of the knee, and it's pointing down in front of the foot here. Try to stop moving my cursor there. As she goes into a quad set, that laser is going to move back on her foot. Okay, so she's going to do something like that. And you'll see that on her foot. This is impossible to substitute with anything but active quad function. You can't make the laser move back onto the foot by trying to move your hip into extension or your trunk into flexion. It's going to have to occur from the knee going into extension, so therefore you're going to have to get knee motion via quad activity. You can't substitute that otherwise. So a patient is going to maybe be working very hard, and they won't be moving that laser at all. And that's going to be a very good recognition moment for the patient and for yourself about how they're able to perform this task. So you can't substitute anymore for your patient being inefficient. All right, so that's going to be great. Once they have established that they can move actively back into extension numerous times like that, okay, then you might be able to help them get feedback for gaining that terminal extension during walking. Okay, so she's going to work on heel strike and terminal extension and maintaining that laser on the shoe as she acquires weight bearing. With an inefficient quad, that laser is going to want to push right off the foot or the shoe as soon as they go into full weight bearing there. All right. So that can be a nice application for transition to gait to make sure they understand how to hold their quad from making that knee become unstable. Now, if we move further and we want to add resistance to that, we can just do a standard terminal knee extension. But what you're going to see is adding resistance. Do they go back into their substitution pattern or they're cheating, quote unquote? Okay. Or are they able to just get terminal knee extension from quad efficiency and having that laser move up onto the shoe? So that's going to be the benefit of having it both without resistance or adding load in quad setting to gain terminal knee extension in this case. Okay. So now that you've worked on that with your patient, if they can't get it and sustain that improvement, or they're really struggling, I automatically send them home with a patient pack. They have to be able to do this for repetitions. Most patients, in my experience, can learn this. There are some who can't. And whether it's effusion and swelling, whether it's pain levels, maybe there's some psychological overlay with that. They can't nail this. Well, I'm not going to allow them to go home on a Thursday to not get to my clinic until Tuesday and have them perform 4 or 5 days of inefficient quad function. I need them to get this in their first week in the clinic. So if they can't show that they can do this with the efficiency, they're going to get a patient pack for home. Okay, and I'm just going to sell them that. I'm going to tell them, hey, you don't want to get behind. I highly encourage you to get this. They can make their own decision, right? But this is the easiest way to make sure that they're doing the home exercise program efficiently and correctly at home. All right. All right, so let's look at another gait application here, and then we'll get to the other videos that are behind this. So this particular patient, he has a longer history that's a little more complex. So he actually fell down his 3 stairs in his garage. So he fell onto the concrete directly onto his knee. He had a small patellar fracture, but he ruptured his quadriceps tendon. When he was prepping for surgery, which was a few days later after some of the irritation and effusion came down, he developed a blood clot. Okay. So we had to wait on surgery for him because of the blood clot. Then he had surgery. He had a post-operative infection. So we had to manage the infection first before we started some therapy. So that really pushed him back, put him in a knee immobilizer anyway because of the quad repair protocol. So he was really far behind. So he had also developed some changes in gait, and he needed some neuromuscular reeducation, some remapping in his brain for gait. But most of his deficit was actually into knee flexion. He was locked out for so long because of all the protocol and all the things that I mentioned before. So he was very stiff into flexion. So he had a significant limp, didn't like to flex his knee. So we put the laser actually to the side of his leg, and we put it midway up the thigh so it was above his incision by my 3 thumb lengths. So that was my landmark for the application in this case. So as he starts to walk through, our goal was to get the laser to actually move forward so it was level to the other foot during the gait cycle. So you'll see it right there. Let me get one more. I think there's a cleaner one right there. Okay, so let me get rid of this cursor. So you can see a terminal stance there on the right foot that we're trying to get his hip to come forward so his knee will go through more flexion. And that was the measurement of the laser, is to get to be level with his stance leg so he didn't come off of terminal stance too quickly. and therefore you had a shortened stride length, okay, on that side. And so if we go through more gait cycles, okay, for this particular application, he would keep the laser on the floor, on the sport floor here, for a longer period of time. And the encouragement was to make sure it went all the way to the stance leg toe. So if I back this up, and I'm just going to let it play, so I'll get this cursor out of the way. But you can see how the first couple, he really struggles to try to get it to his other toe. There you go. Okay, so keep that toe on the ground longer and bend that knee to normalize that gait cycle. He still has a heel strike coming through during swing phase and initial contact. And now he starts to get it. He also got a patient pack for home because he was fear avoidant of falling, okay, liked to stay in his walker around the house. This is several months later, but he was complicated. I needed him to get daily feedback on getting that knee to flex during the gait cycle. So keeping the toe on the ground longer and then hitting the heel for initial contact as he went through. All right, let's watch that one more time so you can kind of see how he went through this. All right, so the first two steps, he hardly gets to the midfoot, and then he starts focusing on that laser staying on the ground longer, works through knee flexion. There we go. Good, okay. Just to help him understand that he needs to keep his right foot on the ground longer and bend his knee in order to bring it through. Otherwise, he was just peg legging and circumducting his hip to bring that all the way through the gait cycle. All right. So now you've seen two applications that might be applied for gait using motion guidance for this post-op population. Why don't we go through these two on the screen here? So let's go to this right one. See if I can make this a little bigger. Now that at least isolates the screen. So you can see this person's post-operative in their first phase. If you're not following us on social media on the regular basis on Instagram or on Facebook, we also have a Twitter account, you're missing a lot of gold that's starting to come out with utilizing this system internationally. So this is from Jay Lienz, and he has a person on a leg press here. He has put the motion guidance device well above her surgical portals, so you standardize it up. And the laser is going to be projecting down. And as she goes through a leg press, the goal there is to have the laser get onto the white tape, trying to emphasize going through terminal knee extension, or at least close to that based on their preference. So you'll see that laser come down and get onto the tape. And she was just struggling to get that quad to fire through a larger range of motion. So this is motivating for her to get that all the way down there, tighten up her quad. The only way that laser is going to move down there through terminal knee extension, we'll play that again, is to go through extension at the knee. All right. And as he's mentioning here, an external focus of attention. So that's in the motivation piece. Hopefully we're all well aware of Gabby Wolf's research now, some even coming from Dusty Grooms from the University of Ohio. David Sherman just put out an external focus of attention using our laser in 2021. You can look for that. I believe the title was something about performance and balance. These are really great for skill acquisition and for learning. Okay, learning being long-term reproduction of the skill, not just performance, which would be the immediate reproduction of the skill. Learning and retention are going to be synonymous in this case. All right. So that's post-operative. As you start to progress these people, you could progress them into single leg stance. Okay. Further into the rehab process. Let me get rid of that noise there. Same activity, but you can see the laser really start to struggle toward terminal knee extension for control. And you can see your knee moving around there. Okay. That's going to be great feedback for you and the patient. Even if they don't want to look at it, you could record that with your phone and then show it to them later and see if they're starting to have abnormal. See, is there? Okay, there we go. Movement as they gain terminal knee extension, trying to gain that control. Okay. The laser is only going to move down there if they go through knee extension. And a nice endpoint there to control that. Okay. I believe this one was sent to us from Ali Gokler, the Motor Learning Institute in Europe. If you're not following them, I recommend you follow them. They're doing great things with all types of motor control and motor learning. Great things to learn, and they're using our device for some of their applications. So we appreciate that. Shout out by Ali and the Motor Learning Institute and Benjamin Say. All right. Now, the focus of this current talk was that early phase of rehab and getting into some open chain, then progressing to some closed chain things. I'm going to show you a video that's on our webinar series that's also available for purchase. It's 5.5, almost 6 hours of Con Ed for $100, $99 US. That takes you through all applications as well as some research on motor learning and applications for retention and things like that I just mentioned. It's on our website. It goes through the shoulder, it goes through the head, neck, it goes through the trunk, and it goes through the lower extremity, including the knee. And this is one video that we have on that series. But this was a patient that came in. She had tore her right ACL. She wanted to start. She was doing great with range of motion, with quad function. She wanted to get released to more activities. So we've gone through some of the research applications with her, single leg get-ups from a standard height chair, seeing how many repetitions she can do, whether it was over 22 or not, going through single leg hop for distance, going through some drop jumping. So we just decided before getting to a lot of those maneuvers, if we can just watch her jump and see what the laser does and see her control over a series of 10 jumps. So here's her video, and I slow it down to slow motion. Here, get rid of the audio. And so you can see the laser come through on those targets that are in front of her, okay? And so what we're looking for is dramatic changes, whether she has a depth issue, whether it really comes across midline. And you'll see a few jumps here as she starts to get her arm swing more comfortable, whether we see excessive excursion of that laser. So let's watch a few more. There we go right there. Okay, so really plain to see on a video. So if you don't have a motion capture system that can really break this stuff down, just use your phone and use the motion guidance system and have her understand the value of delayed feedback, post feedback, and having her see what happened during that particular jump. So if I bring this back to that one jump, you'll see how far over the midline she comes with this next jump. So she collapses in, and that could be detrimental right there. Okay, so she has a weight shift after actually over toward her left side, it looks like. She's not getting excessive trunk forward lean for power, and that right side couldn't control that laser like it did or control the knee, which is the laser's reproduction of the knee motion. So we had to work on that. So 2 weeks later, we redid this test. She was much more aware. We went through further conditioning. She was very compliant at home, and she corrected this over 10 jumps. And that allowed us to progress further through the protocol with further strengthening and control. So we'll revisit this on another webinar and a future time so that you can see the progressions into more dynamic uses of motion guidance. But that's a great video to show how you can utilize that for some testing. Okay, so let me bring my screen back up here. Let's see here. There we go. All right, so let me stop my screen share. There we go. All right. Okay, so that's some good insight, hopefully, that you can take with you into clinic about how to utilize the motion guidance device for that early postoperative knee rehabilitation, getting the quad to go through terminal extension, gaining that terminal extension, working on it with gait, and then progressing into some closed chain options. And then I gave you a little bit extra there with that jump analysis. All right. If you have any questions, hit us up on social media or email the website. It's info@motionguidance.com. I'm happy to interact with anybody who needs some guidance. And if you want to check out the online tutorial modules on our website, those are located there. Just $99 takes you through the head, neck, the trunk, the shoulder, and the knee. Wonderful resource that we have for you. And make sure you keep checking back in with us for future topics. Hope you have a great day.